is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Today's webinar is entitled Supporting Paraprofessionals to Support Students with IEPs. Our presenters today are Iris Jacobson and Dawn Mirth Johnson. Iris is an educational consultant at the Department of Public Instruction. Iris provides guidance to Wisconsin educators and families related to paraprofessionals. In addition, her experiences around her work of paraprofessionals include being a paraprofessional and working with paraprofessionals in the classroom and at the district level. Dawn is joining the team at the DPI as a speech and language and assistive technology consultant. She has 26 years of clinical and supervisory experience, primarily in the school setting. She has been an active member and volunteer leader of the Wisconsin Speech and Language Pathologist and Audiologist Association, serving as past president and vice president of School Services. It gives me great pleasure to introduce to you Iris and Dawn. Ladies.
Well, thank you, Bonnie. It's a pleasure to be here today and share our thoughts on paraprofessionals with everyone. To get started, I would like to just go through what we're going to share. I got to figure out how to advance my slides. Bear with me just a little bit. I thought I had this figured out.
And you can go to the bottom of the screen there and push the arrow.
There. Thank you so much, Bonnie.
Yep.
It's not advancing. There it goes. Yay. Okay, so today we're going to cover for you the definition and qualifications of a paraprofessional and a comparison of teachers versus paraprofessionals. We also have some information on what an intervener is compared to a paraprofessional, and then paraprofessionals in the speech and language world. Dawn is going to share some of that with us as well. And then what trainings are available and just different roles that paraprofessionals play in our schools. So first off, let's just share the definition in general. So the way we describe a paraprofessional in the special education realm is called a special education aide. An aide means a school employee who works under the direct supervision of a licensed teacher in a school or district whose responsibilities include, but are not limited to, supporting the lesson plan of the licensed teacher, providing technical assistance to the teacher, and helping with classroom control or management. And, you know, a lot of our other duties as assigned can also be added on a paraprofessionals contract. There's a link there to our Wisconsin DPI webpage about paraprofessionals as well. So if we look at the licensing, there is a license requirement for a special education aide, program aide from our Department of Public Instruction. And this would be for any person employed as a school district special education program aide. They must hold a license under this subsection. So a license as a special education program aide may be issued to an applicant who is at least 18 years of age, is recommended by the district administrator of the employing school district, and the administrator, or it could be the administrator of a CISO or other designated official to receive a license under this section. In addition, the special education program aide must have a high school diploma or an equivalent degree. It will be the responsibility of the employing district, so the district or the CISO, who's ever recommending the license to DPI, to decide what they accept as a high school diploma or equivalent degree. And there's some guidance for our districts on that on PI 1622, if you want to look that up as a public law. And let's keep going here. I'm going to fly through some slides, but if you have any questions, feel free to put them in the chat, and Bonnie will let me know that you have questions. So who needs that license? We might ask. So a paraprofessional who is assigned to support the provision of any special education services pursuant to an individual educational program or IEP must hold the special education program aid license, which has a license number, which is, I love it, it's 007, but then there's a 0 after it. So it's 0070. Unless the individual holds any other valid Wisconsin Department of Public Instruction license. So if they hold a teacher's license, they may not need to meet the qualifications of a special ed program aid license as well. So that's one example. So who also needs that license? Sometimes we don't think of this, but a paraprofessional hired to provide supports to students with IEPs during transportation would also need to hold that license. And this would be to and from school as required by a special ed paraprofessional. So sometimes we use these terms different ways. We call it a special, the official term is special education program aid, and overarching paraprofessional language, that term is used more frequently. But when it comes to licensing, there's a difference between a Title I paraprofessional and a special education program aid. So just to make that clear, sometimes we use the term paraprofessional overall, but there are different forms of licensing depending on what type of school. If you're a Title I school, what kind of license you might need. And if anybody has any questions on that, I can clarify that if needed. So, oops, I pull on my cord and then my headset falls off. Here we go. So some differences or some differences between a teacher and a paraprofessional role. If you could see there, a teacher does the major planning and delivery of initial, and I say initial instruction, because for some of our students, they need to be retaught or have instruction repeated or prompted, and therefore paraprofessionals can follow that lesson plan of a teacher once a teacher has initially taught that lesson. So diagnosing learning needs is a teacher responsibility and not a paraprofessional. The paraprofessional would only provide technical assistance to the teacher, like provide some observations or information they might have. They may be asked to provide information they know about the student that's pertinent for the student's IEP. But other than that, the learning needs are the responsibility of the teacher. The teacher prescribes the content delivery for the classroom activities, so the planning and organization around that, and then the paraprofessional can help have those implemented. But the planning is definitely done by the teacher. And the paraprofessional can also help with classroom management, especially if they're trained in specific techniques with for sensory needs or whatever. They can definitely help out with that. Assisting another teacher role would be assessing students' learning and evaluating the effects of instruction. So assessments and evaluation of learning and instruction and the progress monitoring of students' progress is also the teacher role. Paraprofessionals cannot be assigned teacher duties. And when it comes to reporting outcomes to administrators and parents, that is a teacher's responsibility. However, a paraprofessional can assist in collecting data and providing information to the teacher and administrators for those reports. So I'm just going to pause there for a minute because I went through a lot of major things already and want to know if there are any questions.
We don't have any questions at this time.
Okay, so then let's move on. So this is a very small screen. It may be hard for you to see, but there are other roles that sometimes we might confuse as as a special education aide or a paraprofessional that require additional licensing or different trainings. And one of those is interveners. And interveners are basically the support from deaf-blind technical assistants, and they're promoting the recognition of an intervener. So an intervener would be provided for a student who is deaf and blind and would need additional training on how to work with students in that capacity. There's just new and updating information coming out, and I put the link there to this document. And also what I don't have for you is the link to the National Deaf Blind Organization. So if you just Google National DB, so nationaldb.org, and then search for interveners, you can find that information. But you can see some of the differences that are listed on this slide. An intervener works under the direction of the classroom teacher regardless of supervisory funding source. So, and a paraprofessional works under the direction of the classroom teacher, and usually that funding source comes out of IDEA funding, where an intervener might come out of DHH, which is Department of Health and Human Services. So there are some differences for an intervener and a paraprofessional. An intervener will have specific training on how to support students who are deaf and blind, where a paraprofessional may or may not have that training. So there are some incidences where an intervener may be more appropriate than a paraprofessional. Another difference, and Dawn's going to take over here, I'm going to hand it over to her, is the paraprofessionals in speech and language. So I'll let Dawn share that.
Hi, everyone. As an SLP or speech language pathologist in the schools, I often worked with paraprofessionals that were assigned to students on my caseload. And DPI has specific guidelines to help determine what a paraprofessional should do to support a speech language pathologist in the schools and what they are able to do. Some of those duties include maintaining and programming communication equipment that students use. That can take an awful lot of time, and usually the paraprofessionals help the speech language pathologist practice at the top of their license, and by taking some of those duties off of their plate can free up more time to work with the students. Other duties include providing clerical or scheduling support for the speech language pathologist, assisting with supporting student behavior and social engagement, either within the classroom or within a pull-out resource room environment. The paraprofessional can collect data for the speech language pathologist and also review or reinforce skills that were introduced by the speech language pathologist. We've attached this guide to the PowerPoint here as well, and this guide comes from a bulletin, and I believe it was from 2010 that came out from the Wisconsin Department of Public Instruction. So this is not a new thing. Paraprofessionals in speech and language have been around for a while. Some states actually license a speech language pathology assistant, but in Wisconsin, that is not a licensed position. So it falls under the role of paraprofessional in speech and language and follows the licensing that Iris talked about previously. The support from the paraprofessional cannot supplant instruction. So it can't take the place of the instruction of the speech language pathologist, and regular continuing interaction should take place between the paraprofessional and the speech language pathologist to ensure that the use of techniques is what is recommended. And then we can go to the next slide.
And it advanced.
There we go. All right. So paraprofessionals must be supported by teachers and administrators in their communication channels and systems of communication, and those should be set up ahead of time with families so that everybody is aware of what's going on with a particular student, and when there are changes, they know how to communicate those changes with the team and with the families. Not only should paraprofessionals have the clear how and what communication channels established, but the school should also establish protocols on how they're going to communicate that information with families, and then clearly outline the role of the teacher compared to the role of the paraprofessional. In addition, maybe more training is needed to better understand and build empathy for families of students with more significant needs so that the paraprofessional can understand and support the individual family hopes, dreams, fears, and concerns for their student. And next slide. Yep.
Yeah, it's not advancing from over here. We're not seeing the advancing, so you could try the arrow buttons again or go back and
Yeah,
then start again.
Do you see the collaboration screen right now?
I do.
I don't.
Do you see it, Dawn?
I do, yeah.
Well, I don't know what's going on here. So, well, let's just go ahead, and if unfortunately if I'm in the minority, that's great, but right now I'm not seeing that. So go ahead, you guys, and sorry for the interruption.
No, that's okay. We want to make sure people are seeing what we're seeing, and if they're not, they could put in the chat. We are on the collaboration screen right now.
Oh,
You should be seeing it.
now I have the screen that says training for paraprofessionals.
Okay,
It
so
seems
it's
like
just a
there's a
little bit
lag.
behind.
Yeah.
And you might want to just advance it once again and see. Now I have the collaboration screen.
Okay, perfect. Okay, so
Thank you.
talking about
Thank you.
collaboration, um, those paraprofessionals need systems in place on how they're going to receive updates and be able to communicate information and data to other educators on the team about how the students are doing. Paraprofessionals should be kept up to date on any changes that occur with the IEP. Oftentimes, when I was in IEP meetings in the schools, the paraprofessionals were not always included in those meetings. And, you know, it's very important that you have some method of communication so that when changes are made in the IEP, that the professionals that work with those students can be kept up to date on what those changes are, because that might impact this type of supports that they provide to those individual students. Parents should also communicate with the classroom teacher and or the case manager to ensure information that is provided is shared with the whole team, because sometimes if there's just communication between the paraprofessional and the parent, that information doesn't always go to the entire team. Which leads us to our next slide, talking about communication. And like I said, we want to make sure that that is information that is going out to the entire team. So if you want to find out how your child is doing, the best person to go to would be the case manager for your student. And then the case manager is responsible for collaborating with the entire team, including the child's classroom teacher, to make sure that everyone is on the same page and using, like, say, the same prompts and supports and things that that individual student needs to succeed in their education program. The next slide talks a little bit about confidentiality, and there's two different types of things to consider here with confidentiality. There is FERPA. Here it comes. So FERPA is the Family Education Rights and Privacy Act, and it's the federal law that protects the privacy of student education records. And then many of you have probably heard of HIPAA. HIPAA is the Health Insurance Portability and Accountability Act, which is a national standard that protects sensitive patient health information. So generally, FERPA is what applies in the schools, but there's an overlap between the two. But the provisions of FERPA applies to all students that receive special education and related services under IDEA, and it gives parents or eligible students more control over their educational records. It also prohibits educational institutions from disclosing personally identifiable information in education records without permission from the eligible student, or if the student is a minor, from the parents. So paraprofessionals are responsible for keeping information confidential when they work with students and others in the environment at school. And that's something that we often had to try to remind paraprofessionals and teachers, especially when lunchroom conversations would happen in a school, or conversations by the copy machine, things like that, and just making sure that privacy and identity were protected and kept confidential.
Thank you, Dawn. And I just want to add on to that, that sometimes um, there's information that's not shared with general education teachers as well as paraprofessionals, because that's a protection for families. Sometimes there's very sensitive things shared at meetings or in confidentiality that is not directly related to the care and supports that are needed that may need to be protected, and that part of confidentiality is there too. Sometimes I would get the questions like, well, shouldn't the parent know everything? Well, that's an individual decision made at an IEP team or amongst the educators involved, and the family does have protective rights over who does get what information. Right, but you do want paras to have the information they need in order to perform the tasks that they're entrusted to do. So with that, some more on roles of a paraprofessional. You know, Dawn shared several, and just to reiterate that what she shared are the same for speech and language as they are for any role that a paraprofessional will have. It's just sometimes we tend to separate out different disability areas of how a paraprofessional works, and that really isn't the case. It doesn't matter a disability categorical area. It matters on what the district and team has decided is the role for a paraprofessional in that employment and with those particular students they may be supporting. So collaboration, again, I'll reiterate, is very important in making sure that all are on the same page. And paras assist then in supporting student behaviors as well as any social engagement. So they may be assigned to the playground to make sure to help set up good social relationships for students, or to help monitor that they are getting out and playing and interacting with other students. So that could be one way that they support that behavior. They may also be assigned to assist in other extracurricular activities that go on in a school environment during the lunchroom or wherever that support the social aspect. Supporting the lesson plan is another one through review and reinforcement of skills. Again, remember they don't teach the initial lesson, but for some of our students with more significant needs, they may need consistent repetition, or they may be learning a skill out in the community. And once under the direct supervision of the teacher, that para is trained and feels confident in repeating those lessons in the environments, that's perfectly acceptable. They can assist with monitoring student progress. Remember, they don't monitor the progress, but they provide the information for the teacher to help monitor that progress. So through observations and data collection and communication, they can help a teacher know what a student is doing. And they provide supports, modifications, and adaptive materials. They could, depending on the school district's assignment and what their individual needs are for a particular student needs or classroom needs, they can do all sorts of things. Make visual schedules, do the checklists, write up directions step by step, opportunities for choice. Sometimes I would get a question on like a student can have a fidget. Will do if they don't know which fidget to give them. Can they give them a choice? Or sometimes they might be in an environment where the particular fidgets aren't there that are prescribed, or that, or that the student normally uses, but the para can sense that the student needs something to fidget with. They certainly have the autonomy of providing something that's in that environment for them. So if there's something that could replace or is very similar, that's perfectly okay. So some of those things, but always having that discussion. I go back up to the first bullet of collaborating and communicating, and having that constant opportunity, and I guess culture, in that there's a easy way to talk to each other about what's going on with students, keeping the confidentiality in play. So here's a really nice, I think this TIE Center does a really nice job of presenting inclusive practices for our students with the most significant cognitive disabilities. And oftentimes, there isn't a whole lot of specific training because of the very unique needs our students can present. So this particular article, or it's like a 3 to 4 page read. Obviously, the first page has a nice picture on it, but how paraprofessionals can support our students in an inclusive classroom. And I just want to share that sometimes when we read articles and stuff that are not right from our department, or our directives that are right from your school district, there might be other policies that a state or a district has in place that may be different than what is read. So like in this article, there may be, I don't know of any right off, but I always give a caution when we read something outside of our state or outside of um, our policies and procedures, that we always make sure that we're going back to that collaboration and checking in with our own districts and classroom case managers, that this is also applies for that school or that particular situation. But again, this is a really nice read. I know our students with the most significant needs, that's a passion of mine, to see more inclusive opportunities as appropriate for those students. So, and then there are different levels of support that can be provided. And we often think of, where is that level of support? Again, it would be an individual IEP team decision on what kinds of supports each student needs. I always say there's never and never and never and always, that no two are ever the same or alike. So sometimes I guide parents in knowing, now wait a minute, everything that one student has doesn't necessarily meet the needs of another student. So understanding the different levels and making sure that each student has what they need to support their disability related needs in the school setting is important. So just some examples of levels would be, for a group of 5 students, like for a low level, um, that somebody's always available, but not necessarily needed on a regular basis for a student. So if there were a group of 5 students with IEPs in a general education math class, let's say, the para is in attendance and is available to support when those students need it, and that when they need it would be clearly communicated between the teachers and the team of which students need support when. And then the support might include checking on their work, keeping them on task, reminding them of directions, similar to that. And then a more medium level of support, which is necessary on a more regular basis, may be an example of a student having a job in the community, or the para may accompany them to that job and provide verbal cues as in a job coach type of role. That's specifically with our older students at the high school level. Paras also can provide occasional prompts when students struggle to remember the next steps in a task, or need a reminder to stay on task. A very high level of support when it's absolutely necessary for the student to learn and must be provided constantly is much more intrusive in nature. So we always want to focus on having our students be as independent. We're going to talk about that as possible, but sometimes there are situations where we need a high level of support for some of our students. And then what they shouldn't do, of course, we've said this several times already, they do not provide initial instruction and they do not make decisions about activities, lessons, or content or environments a student can have access to. So when I say the environments, they do not make the LRE environment, like to remove a student from general ed or time that's not already mentioned in the IEP. So they cannot make those placement decisions. It needs to be clearly communicated between the teacher what the IEP requires. So I think I will pause there for a second and see if there's any questions. And if not, we'll turn it over to Dawn.
Actually, there is a question that relates to some things that you just said, Iris, but going back to what Dawn was talking about individuals in speech and language being used as the paraprofessionals, and the memo that came out in 2010, I believe you said. The question revolves around, there's been in the past, from this person's knowledge, a discussion of whether or not there should be like a speech and language assistant, or as you had mentioned, there are different licensures in different states. Some people have felt that a lot of the instruction that their kids are getting is actually being provided by a paraprofessional because of the shortage of speech and language people that are out there. What are your feelings in that area, this person who is interested in knowing?
So before Dawn goes into answering that first bullet on there
Yes.
is, yeah, I do know paras, and I have had that situation when I was a teacher, that paras do provide instruction. However, it's not the initial instruction, and it is under the direct supervision of a licensed teacher. So with that started the conversation, or to the answer, I'll let Dawn answer it specifically for speech and language.
Okay, so paraprofessionals cannot provide that specially designed instruction unless, like Iris said, it is review and reinforcement of skills that have already been taught by the speech language pathologist. So there are cases where like you said, they may look like they're providing the services, but it may be that maybe the speech language pathologist works with the student 2 days a week or 3 days a week, and then the paraprofessional provides that review and reinforcement either daily or an extra day or two during the week, whatever that student needs. So that information, though, should be discussed during the IEP meeting with input from everyone that's involved, and that the parents should know the type of service that their student is receiving. Just, it needs to be clearly made. The parents need to be aware of what types of services their student is receiving, and it could be that review and reinforcement of skills. But they should be initially taught by the speech language pathologist, and there should be good communication back and forth, checking in and monitoring, and teaching what types of cues and prompts work for that student depending on the skill that they need assistance with.
And in no way should a paraprofessional be the replacement for a teacher or a speech and language pathologist who is unable to be hired, or the district has to provide FAPE directly in whatever way they can in the meantime, or provide compensatory services if those were not provided. A paraprofessional cannot take on that role in the absence of the teacher or speech and language pathologist.
Okay,
Right.
thank you.
Okay.
Okay,
And
and
then I'll let
if you need
Dawn,
more clarification, feel free to type in an additional question in the chat. But we're going to move on to some additional considerations. So there are some other things that the team and the paraprofessionals should consider when they're working with a student. And one of those is limiting close proximity whenever possible, because sometimes having a paraprofessional in close proximity can impact the social engagement and the type of interactions the student with disabilities is able to have with peers and adults in their environment. So there's a need to balance the distance that the paraprofessional can be from the student while still being close enough to provide timely support to that student. One thing that I always liked to say to the paraprofessionals I worked with is you should be trying to work yourself out of a job, so that student can become as independent as possible and not need constant prompting and become prompt dependent and not be able to do a task without being prompted by someone right next to them. And that, that constant close proximity can also cause the student to feel like they don't have as much personal control. It can separate kids from their classmates and can create, like I said, a dependence on adults. It could also interfere with the instruction of other students at sometimes. So it's important for the IEP team to find opportunities for looking for peer supports or natural supports, which are some of the other considerations we're going to discuss in a couple minutes, and determine when they can start fading that support. In addition, the IEP team should identify times in the student's day when the paraprofessional may not be needed and the student can be independent and start trying to fade that support back as well. So looking at what natural supports are, it's promoting feelings of belonging and participation in life. So it draws on people's natural inclination to care for others and to form relationships that last, and it's not an artificial relationship. People have a desire to be together and to help each other. And so those natural supports are things that naturally occur in the environment. Peers are wonderful. They learn a lot from watching the adults in their environment, and before you know it, they're being helpful. And sometimes what I found is working with some of the students that I had, they listened to their peers before they would listen to the adult at points. If the peer said, "Come on, let's go," and the paraprofessional had been trying to get them to transition to the next activity, but the peer just grabbed their hand and they started walking right with them. So those natural supports can be very powerful, and help to build more independence and encourage those peer relationships in the school community. So why do we need to talk about independence? Research has shown that students that receive direct one-on-one support from a paraprofessional often have fewer social relationships with their peers and less independence as a result than students who do not receive one-on-one support. So we want to ensure that the paraprofessional skills focus on improving the independence of students in social situations, academic settings. Both of those areas are crucial. And we're preparing those students for life beyond school eventually. So anytime we can help nurture their independent skills throughout the school day, we should take advantage of those moments. Students should be involved at an early time at making choices, which will help them in making choices in the future. When they actually get the opportunity to make choices on their own. If they've been given that opportunity all along, it really helps.
Thank you,
And
Dawn. And
yeah,
and
back to you.
starting, like you said, from an early age at promoting that independence and promoting peer supports and natural supports early on. Again, I know that I often get questions or concerns that, well, my child needs a one-on-one and the school district says they don't do that, right? That's a very common question. And I'm like, well, now let's just sit back and think about what does your student actually need? What are their disability related needs and where are the supports needed? Maybe they don't need a one-on-one and a single person all day long, every moment of the day, but they need certain things at certain times. And that's where that difference comes in. Or maybe there needs to be an extra set of eyes to make sure and watch out for the safety of a particular student, but not necessarily need to be, sometimes we call it Velcroed right next to the student, right? And that way, because we don't want to have barriers like Dawn just described, where students are not allowed the independence they should have and the choice and control, which leads to a better quality of life overall in the end. So understanding that balance and maybe not getting too hung up on needing a one-on-one, but specifically thinking about where and when those needs are actually needed. And again, there are situations where a one-on-one is absolutely needed for medical reasons and not to be distracted from other things going on. So, you know, understanding the difference between all that can be very helpful. And then we're done with our presentation. So we have some time for just some discussion, I believe, Bonnie, and some questions, about maybe 10 minutes or a little less than that.
Excuse me. The other question that was a follow-up to the question that was asked before is, what would be your feeling about having the Department of Public Instruction or licensing department look into like a position that would be under a speech and language person, like a speech and language associate or something like that? What would your feelings be in that area, especially in light of the fact that there are rural areas in our state that don't have the necessary services? And that was a follow-up to the question before.
Sure. If you're referring to like a licensure for a speech language pathology assistant, so currently Wisconsin does not have that. Other states do. The Wisconsin Speech Language Hearing Association has been exploring people's feelings on, you know, pursuing a licensure in that area, and right now they're just in the exploration stage. So actual legislation has not been proposed at this time for that, but that is something that an ad hoc committee is looking into and has at various times in the past. So it is something that, you know, may come into fruition at some time, but at this point, you know, DPI does not license a speech language pathology assistant.
And I don't know, Dawn, if you want to address, there are opportunities through virtual programming. I know some of our rural districts have virtual speech and language therapists, maybe not virtual, but remote.
Mhm.
But do you know where I'm going with that? That
Yeah,
might,
so telepractice is a common, it's become way more common in the last few years, but it is a common way to meet the needs. So not every student is able to benefit from telepractice versus, you know, direct person-to-person instruction. But telepractice has been found to be an effective way to provide that therapy, especially for districts that are unable to hire um, a speech language pathologist for some time in their district. There's also a, a movement even within DPI where they're looking at recruitment and retention for all areas, including speech and language. And I've had some recent discussions with Dr. Barbara Van Haren in the DPI department regarding that. So more will be to come, but you know, at this point, it's not a licensed position.
and we even have the situation of recruitment and retention for paraprofessionals, let alone not just our licensed teachers, right? So it's across the board on all our educators that's something that's being addressed. Are there
And
any other
actually,
questions? Go ahead. Sorry.
no, that's okay. Actually, there is a a follow-up to that, well, it's not a follow-up to that, but basically related to what you just were saying. And that's what is your feelings, both of you, on the role of a paraprofessional in a virtual environment?
Well, if you're referring to telepractice, it's often recommended that a paraprofessional attend those sessions with the student, especially if the student's not able to um, attend without anybody right next to them. So often a paraprofessional will attend those sessions that are provided by the speech language pathologist remotely. And at that point, it's good that they can review, reinforce the skills that are being taught, but also learn some of the techniques that the speech language pathologist might use when teaching those skills, so that those can be followed through during the week by the paraprofessional in the classroom.
And I think that's a great question, and it probably might be something we would add to one of our slides here of when I think back, 2 years when we went remote, right? And nobody was, hardly anybody was showing up at a school, and what was paraprofessionals' role in that, right? And so some of their roles again could be meeting with students and reinforcing skills. They could be behind the scenes and helping navigate the equipment students need to navigate, making sure they have the right systems in place and that their cameras are working. I mean, all sorts of stuff like that. Again, the same rules would apply, that the only pieces they could not do would be that direct instruction and the other pieces that we talked about in the presentation. Yeah, so again, paras can be a very supportive role in a virtual type of platform as well.
So the next question I have is, will you be having a follow-up webinar giving us strategies on how to support paras in particular? What kinds of things could people do to support them in the school settings?
We certainly could and get more specific on the supports. Again, we would probably lean toward, it depends on the individual situation. There's so many things a para can do. And I guess I would want to know more specifically on how you're thinking, like, do they need more training and where did they get that training, that kind of support, or sometimes it just depends on what the needs of the students are bringing to the table. That's how we would support our paras in supporting our students.
And actually, the person just typed in all of the above. So I would
Love
I
it.
would guess that would be
Yeah.
all of that information.
Yeah. Yeah, that's a lot. But yeah, we could explore some of that in the future. Bonnie, if you want to address that with us, that'd be fine.
Sure, and I
And
can do that. I think that several other people have made comments about, sometimes the paraprofessionals feel like they're in their own world and they're not necessarily supported like the way they believe that maybe some of the teachers might be supported. So what kinds of things can teachers maybe do, can administrators maybe do to
yeah.
help them to be, better at their jobs and to feel more supported?
Mhm. Yeah, and I think, like Iris said, there's a variety of situations, but for some paraprofessionals that work with students with autism, there are training modules that are already developed on different platforms that schools will have their paraprofessionals, go through, and I think that's very helpful, at least for children. With autism spectrum disorders. And I'm sure there's other training modules out there that um, are available or schools have developed on their own, and it would be nice to be aware of those and be able to put those out for people to use.
Yeah, and
And I think
actually, I think that's a really good point, because I think that a lot of individuals who serve as paraprofessionals are looking for those possibilities and looking for those, tools to be able to help them do their job better.
Mhm.
Yeah, and don't necessarily have the time to search the web for them, right? And we as a State Department don't advocate or promote any particular training or vendor or publisher, because we have to stay very neutral and very. So sometimes just giving the ideas we can do, but we can't maybe do specific lead on to any particular vendors for that matter.
And
Yeah.
actually, I don't have any other questions at this time, unless if anybody has any others, they could type them in at this time. But I will ask both Dawn and Iris if they have any closing statements that they would like to make at this point.
Sure. And before I actually do that, I was just thinking too about the training question. Often schools don't always have the same individual paraprofessional that works with the same child throughout the day. They may work with different students, and I found that especially in a rural district too, that there were a lot of students that needed help. And so trying to gather the whole team together was always a challenge, and so that everybody could be on the same page. So I think if schools can find the time during some of those periods where they have the training sessions, like in my district, we had one day that was early release for professional development. And then if they could include the paraprofessionals in some of
Exactly.
that professional development, I think that is helpful. Or finding some time in the structure of the day where they could meet as a team, especially on the children that have a lot of significant needs, to get everybody on the same page. I think finding that time is really important so that everybody feels like they are a contributing member of the team and is aware of what strategies work best for that student.
Right, I so agree with that, Dawn. So often, in my experience, paraprofessionals would be arriving at the same time as the student and immediately have duties, and then would leave right after a duty, and there would be no time set aside in a day or a week or during those PD times where they are actually paid to come in and get that training and have the opportunity to collaborate. So I would really lean on administrators to be providing that time and paying our professionals to participate in that way. And as a closing statement, and that's kind of what I wanted to say, sometimes we have to go back to our administrators in our districts and make sure that we are communicating what our needs are in order to support our students in the best way possible.
And I would
Well,
say I've worked with some excellent paraprofessionals over the years, and um, they are so, caring and
Valuable.
really want to do their job well, which leads back to some of that training that we were talking about. And so keeping those lines of communication open are really important on your team so that everybody feels like they are a contributing member of the team and, feels comfortable posing questions that they need help with and problem solving even as a team.
well, thank you both very much. I know that this has been really informative for everybody. I just noticed that you put up the resources page. Do you want to just chat about that for a minute?
Sure. Throughout the presentation, we mentioned links of where you could find additional information, and we did compile those in the back on 2 slides on the back of the or near the at the end of the presentation. And then also at the very end, we put our contact information. If you had any need to contact us directly, you're welcome to do that.
Well, thank you both so very much. I'm sure that I know I learned a lot today, and I'm sure those that participated did as well. So thank you both for a great webinar. This will conclude our webinar for today. Thank you all for joining us. Please be reminded that Wisconsin Facets has over 100 trainings and webinars for the year 2022 and now the year 2023, and that'll be coming up on our website shortly. Please check out the website calendar and register for any of those upcoming trainings that may be of interest to you. And also please watch for the short evaluation that will be coming your way after today's live presentation. Thank you, Dawn. Thank you, Iris. And thank you all for joining us today. Enjoy the rest of your day. Bye-bye, everybody.
Thank you. Bye-bye.